It's a side effect of the drug epidemic. Used needles unintentionally spreading disease, fueling more cases of hepatitis C.
It does make a difference for the individuals that come in and faithfully come and get clean needles.
The Summit County Health District launched its needle exchange program last year, a cheap solution to a potentially costly problem down the road if hepatitis C and HIV numbers spike.
Every time you come to us, it gives us an opportunity to talk to you about the harm reduction, the disease, do testing for Hep C or HIV, and also allow us to give you information and help you get into treatment if you'd like that for your drugs.
And Summit County isn't alone. Ohio has several needle exchange programs across the state in almost every corner except here in the Mahoning Valley.
We had stakeholders that did agree to it and wanted to have it done, and then we had those who are also opposed to it.
Mahoning County health officials say they're not seeing a rise in Hep C cases, but in Trumbull County, where the drug overdoses soared over the years and into 2017, the number of hepatitis C cases saw steady growth over the last 5 years, with only a slight dip from 2016 to 2017. County health officials attribute the drug epidemic to the rising trend, but exploring a needle exchange program in Trumbull County didn't go further than a meeting last year with high-ranking officials across the county.
A lot of people had a problem with it in their city. They didn't want, to look like they were the only ones that had the problem.
Some of those not in favor of a needle exchange in Trumbull County, Prosecutor Dennis Watkins and Warren City Law Director Greg Hicks. Watkins has publicly called the idea absurd, telling 21 News it would only encourage drug use. And Hicks says his concern is to enforce the law, and once the needle is used to shoot up illegal drugs, it's a chargeable offense. But starting a program in Summit County moved forward without consulting local leaders.
If we can get them Hep C tested, if we can get HIV testing done for them, they can find out their status, they can then use the appropriate precautions to not spread the disease. And then if we can prevent them from getting it from somewhere else, it's a big win.
A possible solution that could stop the cycle of addicted users and the spread of disease before that becomes the next epidemic. With more local news, I'm Lindsay McCoy.